Sometimes bottles are a part of the feeding journey, whether for separation, supplementation, or flexibility. What matters is how we give the bottle. Paced bottle feeding is a method that protects breastfeeding skills. It supports supply, and it helps your baby stay in control of their own intake. Today, we'll talk about why it matters and how to do it. So let's get started with a definition of what paced bottle feeding is. Paced bottle feeding is a baby-led, responsive method of bottle feeding that slows the flow and attempts to mimic the breastfeeding rhythm. This paced bottle feeding method is typically in contrast with what we would consider conventional bottle feeding, which is more fast or a continuous flow. Baby swallows more than intended and ends up taking in more than maybe they would at the breast. So I want to do a quick demo for you about what this looks like. I've got some supplies here today. Very excited about that. So if we kind of hold this bottle up, right, and we think, okay, we typically hold baby in the arm, turn the bottle upright while we're feeding baby. Look how quickly that drips out. So that flow is really fast for a baby to keep up with, right? So a simple act of turning it sideways slows that down significantly. So here, gravity is helping. Here, gravity is not helping. And for those of us who are listening and not watching, I'm turning the bottle upside down, and the bottle is dripping out at about this rate. Drip, 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 drip. So very kind of quick there. Now, if I turn it horizontally where the water is just filling the tip of the nipple, I actually don't have anything coming out of the bottle right now. So it's not dripping at any particular rate. And that goes to show that when we hold the bottle horizontally, we can slow the flow of the bottle and make it so that babies have to either establish a decent effectiveness at removing the milk or do a little bit more of what they do at the breast in terms of active feeding. They don't just sort of have to sit passively at the nipple while the milk continues to flow into their mouth. So it's really good, especially in the early days. If you do need to use a bottle, think before 4 to 6 weeks, it's a great tool to use to make sure that babies don't develop that flow preference, which we'll talk about later as well. When giving a breastfed baby the bottle, why do we like paced bottle feeding? Paced bottle feeding gives your baby a say in how much they take instead of the bottle deciding for them. So why does paced bottle feeding matter? I want to talk about the concept of something called the cascade effect, where if the bottle flow is too fast, baby ends up taking more than they need, and that can lead to a series of potentially unintended consequences. So, baby takes a bottle at a fast flow, they take more than they needed. The parent sees that empty bottle and assumes that baby needed more, and then begins to worry that their supply is low or insufficient in some way. At that point, then the parent supplements more often or pumps less, and that can lead to a true milk supply reduction. Babies begin preferring that faster flow of the milk, and then the latch becomes a struggle at the breast. The ultimate result here in this cascade effect is a downward spiral from one bottle to unnecessary supplementation, potential supply loss, and sometimes early weaning. What's the big fuss about giving a bottle? A bottle isn't just a tool. The way we use it can change the entire course of breastfeeding, triggering a cascade that can result in unnecessary supplementation, decreased supply, and eventually early weaning. So understanding these consequences that can occur from not managing the flow of the milk in the bottle can be helpful in putting into context the importance of paced bottle feeding. So now that we understand the value of it, let's talk a little bit about how to do it. I love that we're going to be able to do a demonstration in this podcast, because a lot of times I feel like I'm just a talking or jabbering head, and I think visual demonstrations are a lot of times very helpful. I also went out and acquired a baby doll whose name I don't have yet. Right now he's Demo Baby, but I need another name for him, and so would love your input. Please leave a comment, send a message, anything like that about what you think his name should be. I think he's a he, but he has really cute long eyelashes too, which a lot of babies do have. So anyway, here's our Demo Baby. And he is going to help us demonstrate what a paste bottle feed should look like today. First, we should be choosing a device that allows controlled flow and protects the breastfeeding relationship. I think that's a really important point, and one that we should kind of pause on. There are multiple other ways you can protect breastfeeding aside from paste bottle feeding. You can feed a baby with a spoon. You can feed a baby with a cup. And even newborns. This is true for newborns, particularly true for newborns. And you can feed a baby with a syringe. Now, this is not the syringe that I would typically choose to feed a baby with. I like a curved tip syringe when you are doing syringe feeding. But these are some alternate methods that you can use to protect breastfeeding and control the flow of the milk so as not to jeopardize the breastfeeding relationship. We are going to talk about paste bottle feeding today, and that's going to be our sort of method of choice, like the ABM says, that controls the flow and protects the relationship, because bottles are used so frequently, and also because sometimes these other tools can become overwhelming. As babies start taking in more volume, those methods might go a little bit slower, and then you might feel like, oh, let's just break down and use a bottle. If you are using a bottle, don't consider it a breakdown. Just know that you can feed with a paste bottle feed approach, where you're holding the bottle more horizontally, and we'll talk about the finer points as well. And that can also control the flow and protect the breastfeeding relationship. So that's our method. And then we're going to talk about positioning baby. Now, you will do this up against you. I've got the microphone here, so it gets a little bit in the way, but I'm going to kind of show you what baby's position should look like. 45-degree angle, baby's positioned upright. The key here is that baby's butt is lower than the head, right? And so that's going to help baby keep that milk down and not create any sort of, difficulty taking in the milk when they're laying flatter. Not to mention, when you lay baby flatter, then you end up tipping the bottle upright more, and then gravity's helping and the flow is faster, all that good stuff. So again, we're going to hold the bottle horizontally, okay? So there we go. So what we want to see is that in this case, I've got water in here, but the milk, when the milk fills up the tip of the nipple, that's perfect. That helps assure that the milk is going to be coming out as baby is sucking on the nipple so that they don't get frustrated. But it prevents it from, again, that situation where if we tip it all the way upright, that very fast flow, which we don't want. So again, baby upright at approximately a 45-degree angle, head is higher than the butt. Hold the bottle horizontally and get it so that the milk is just covering the tip of the nipple there. Of course, by the end of the feed, you will find that you do have to tip the bottle more upright, but if I wish I had a second bottle to demonstrate a lower volume. When you don't have as much volume as you do at the start of the feed, even when you tip it upright, it's not going to be flowing as much as it would if you were tipping it upright from the beginning with all of that other volume that is assisting in how fast the flow is going. So holding the bottle horizontal with the milk just covering the nipple tip. And then what we want to make sure we're doing is something called inviting the latch, which is what we do at the breast. So when we're breastfeeding and holding the breast and sort of aiming the nipple on the upper lip or touching the nose and kind of going from the nose all the way down the chin, or just tapping here on the upper lip with the nipple, that is what's called inviting the latch. And we want to do the same thing with the bottle. So we brush the nipple on the lips, wait for rooting. Of course, this baby has a very teeny tiny mouth because it's not made for breastfeeding, but it gives us a good idea of what we should be doing just positionally, right? So we just kind of brush the nose and upper lip, and you wait for baby to demonstrate that wide open mouth or rooting and indicate that they're ready to open and take the nipple. This is good practice because a lot of times what we see is we just, if baby's not showing those signs, we just kind of push the nipple in there and they get into the habit then of slurping the nipple in and not opening their mouth wide. And when baby is returning to the breast, that translates into a painful, more shallow latch that can cause some damage to the nipple. So we want to make sure that we continue to have them practice that wide gape even with the bottle. Now, baby's on, they had a wide gape, you get the nipple into the mouth. Now you're going to let baby set the pace. So if baby's even going quickly in this position, I'm going to get the water, there we go, all the way to cover the nipple, good. Even in this position, if they're going quickly, and you'll know that by a suck swallow pace that's maybe 1-to-1, you can help them pause by just simply tipping the bottle back down so that the milk is no longer in the nipple. You can kind of see that here. We hold it more horizontally or upright. There's got some water in baby's mouth. Hang on. Oh my goodness. There we go. We need a burp cloth for this. So we've got the nipple in baby's mouth. The milk is covering the tip of the nipple. And we see baby's having a hard time with the flow. We can just gently tip the bottle down. And yes, in this case, there is no more milk in the nipple. And some people do ask the question, oh gosh, does that mean they're going to get more gas in that position? Generally, no. So what triggers baby to swallow is, and so a lot of people ask, oh, will they swallow air? What triggers baby to swallow is a bolus of milk on the tongue. And if they're not getting that bolus of milk on the tongue because they're not consuming the milk because it's not covering the tip of the nipple, they shouldn't be swallowing air. Does it happen sometimes? Absolutely. Follow up with some burps if you're noticing, so try to get some burps out after the feed if you're noticing in particular that baby seems uncomfortable after a bottle feed, especially if it's more so than a breastfeed, and maybe be a little bit judicious about that particular approach. The other thing that you can do is, okay, baby's feeding, the milk is covering the tip of the nipple, and you notice baby is taking in milk too quickly, just take the bottle away. Now, some babies may protest, and that's okay. It's okay if they do. We are here to help them slow the feed down. And so if that means that we need to pause the feed by removing the bottle, then that's what we can do. If baby seems to be managing the flow well, it's still a good idea to pause regularly by removing the bottle, see how fast the volume is being consumed, and make sure that baby's not going to take this bottle in 2 to 3 minutes or something like that. That is a very fast feed, and babies can absolutely do that with a very fast flow, especially if they're very efficient at milk transfer. But we don't want them to do that. That can lead to the flow preference, which we mentioned, and it can make breastfeeding very challenging because they don't get that kind of high rate of flow at the breast. They have to work a little harder for the flow. So another good practice is to, if you're feeding on your left side, to switch sides halfway through the feed, which does support oral development in different areas. Now, we do this with breastfeeding, and so if we do this with paced bottle feeding, it is again another way that we try to make paced bottle feeding as similar to breastfeeding as possible. So another very important thing to remember is that we should end the feed when baby signals. So what does that look like? We're feeding baby, and then they tongue thrust the bottle out of their mouth. We don't have to keep trying to feed. Give them a second. It could be that they're just trying to clear, the milk that they have in their mouth, or, catch a breath or something like that. If you attempt again and they go for it, it's okay to keep eating. But you also want to look for other signs, like they turn away from the bottle. So you're trying to do this, and they're turning away from the bottle or trying to kind of get away. Other indications that they are really satisfied. their lips are sealed. A hungry baby roots when you're touching their cheeks, their lips, anywhere around their mouth. They're opening and sort of indicating that they want to eat. If their lips are sealed, then that's a good indication that they are full. And relaxed hands. Our demo baby comes with relaxed hands, which is not a good indication at the beginning of a feed of what it looks like, because usually babies have these tight little fists up near the face. A lot of times they get in the way. But relaxed hands, fingers that are spread apart, that are no longer clenched in a fist. But what our demo baby does have is a really good spaghetti noodle arm. So that's another good check. Oh, we're full. That arm is relaxed. A hungry baby, if you try to do that, they usually bounce that hand right back to near their face, keeping their hands in a fist, and they don't have a very loose arm. In the case of a very satisfied baby, you could pick that arm up and it just kind of falls right back down. How do we protect breastfeeding when giving the bottle? Think of paced bottle feeding like breastfeeding with a bottle. Slow, responsive, and baby-led. So let's troubleshoot some common questions. I get a lot of questions as we talk about this method, and I want to make sure that we address some of those today. What if you see your baby getting frustrated? Well, that could be a couple different things. First, it could be that the nipple is too fast. The milk volume is overwhelming. Baby might be choking, gulping very loudly, or coughing. And that could be an indication that we need to decrease the rate of flow for the nipple. So if we have, for example, a level 2, we may need to go down to a level 1 or even a preemie nipple. And it's different for every brand. So some brands call them transition nipples, etc. The idea is just that you look at the slower flow or slowest flow nipple that you can obtain for that bottle brand. It could also be that the nipple is too slow. Baby's working very hard, but not satisfied. It is important to adjust the nipple type, but always err towards slow flow unless baby shows consistent fatigue without milk transfer. You might also see the bottle nipple sort of collapsing in on itself. And so say you've been feeding baby, doing your perfect positioning, you've been feeding baby, you take the bottle out, and at 10 minutes there's very minimal volume change. That means the flow is too slow, or that baby's having a difficult time transferring and maybe isn't very effective, but it's certainly an indication that the flow rate is too slow. Baby should not have to work for 45 minutes at the bottle to have a full meal. A normal bottle feed, a normal amount of time for a bottle feed is about 15 to 20 minutes. That's a really good time. That makes it similar to breastfeeding and protects that breastfeeding relationship. How do I know when to change the nipple size? When baby takes an unusually long time to feed and shows fatigue without choking or coughing. Remember, it's not just based on age, but it's based on feeding effectiveness. So, I have seen newborns need a 2 and level 3, a level 2 and a level 3 nipple in very rare circumstances. That's typically when baby's not able to get a good suck, and so the volume that they're getting is exceedingly small, and they're having to work very hard for long periods of time to get small volumes. And sometimes in those cases, we even have to go with alternative feeding methods that we haven't discussed here because there could be some other type of issue going on. But it's not, those levels don't correspond with ages per se. It really does matter whether the baby is able to effectively remove the milk. What if baby is coughing or choking? Then remember what we talked about before. Flow is too fast. Try a slower nipple or put baby in a more upright position. So if baby's coughing or choking and they're about here, yes, here the butt is still lower than the head's higher than the butt, and we're at an angle. But really we see improvement when we put baby a little more upright. That could mean that the nipple you have doesn't have to be adjusted at all, but we've got baby in a more upright position, which makes it easier for them to manage the flow and makes it easier for you to hold the bottle more horizontally. Oh, this is a good one. What if caregivers don't want to do this? It is important for caregivers to also use paced feeding to protect breastfeeding. So sometimes what we see is, Grandma, uses the more conventional feeding methods, holding baby, putting the bottle upright, and you get that drip, 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 that much faster drip. And you try to talk to grandma about it, and she's like, "What are you talking about? I've had 5 kids. Maybe you're one of them. I've had 5 kids, and they all seem to have grown up just fine. I think I know what I'm doing." Well, taking the time to teach grandma or anybody else who's a care provider, we see this a lot of times with daycare providers as well. It's not age particular. It's just what each individual person has traditionally seen or done. Taking that time to teach them the why behind this method, that can go a long way. This isn't just a preference. It actually prevents overfeeding in babies and keeps the baby's breastfeeding skills intact. Frame it as protecting the parent's milk supply and the baby's health. And a lot of times you'll see that it's very difficult at that point for them to not try to comply with that request. It's helpful for baby and it's helpful for you. How many ounces should baby take? This is a great question. And sometimes I think the range is so wide that it's almost unhelpful to know for sure. So that makes it very difficult for us to plan, okay, we're going to be separated for baby. How much volume do we give? A good estimate or a typical range would be somewhere between 1 and 1.5 ounces per hour of separation once the supply is established. Now, that can be a little bit different for everyone. It can be somewhere between 2 and 4 weeks, 4 and 6 weeks. It's kind of a moving target depending on the individual. But the important thing to understand is if you use that as an estimate, it can give you an idea of how much baby might need while you're apart. But again, we shouldn't be striving for rigid volume goals because every baby is different. Definitely in this category, how much they'll be eating and stuff like that varies baby to baby. Remember to mention to the care provider who will be with baby when you're separated that they should be following baby's cues, not bottle markings. Every caregiver needs to use paced bottle feeding because one fast flow bottle can undo a lot of hard work. What are some alternative methods to paced bottle feeding? The spoon, syringe, and cup can all be used to feed your baby while protecting breastfeeding. While we aren't digging into those methods today, we'll definitely address them on the show at some point because these are very useful tools to have. I want to make mention of a very savvy family that came in the other day who was cup feeding their baby when mom needed nipple rest. So she had a few bad latches and some pretty significant nipple damage, and so was giving herself nipple rest during the day, protecting her supply with pumping. And so baby wasn't taking in any formula, and she had the supply that she needed, but it was painful to latch and she needed some time to heal. So they attempted to do a bottle feed. Baby took it way too quickly. It was kind of a scary episode for them because the baby was coughing and kind of choking, and they got a little bit nervous about what they saw, and then baby ended up vomiting it all up as they were trying to kind of burp baby and help baby clear that milk that the baby was choking on. So at that point, they started looking up alternative feeding methods, and they landed on cup feeding. And it's great. I mean, it's a great method, as is spoon feeding. But as you can imagine, I mean, this is kind of a small volume that you give at one time. So as baby's volumes increase, this can be a little bit challenging. So that family in particular, they were unfamiliar with paced bottle feeding. And so I reminded them that sometimes the cup method or the spoon method or even the syringe method can become unsustainable in terms of it just seems to feel like a lot as those volumes get bigger. And in that case, returning to using the bottle while implementing the paced bottle feeding methods can sometimes be the solution. As we discussed, paced bottle feeding does definitely help control the flow and sets baby up for success in terms of making it a baby-led feeding process. So let's talk about a couple instances when bottles are helpful and or necessary. Obviously, some very straightforward ones come to mind when there is separation between mom and baby, so we can't breastfeed. So either mom's returning to work or, right after birth, baby is sent to the NICU Mom is still recovering, and eventually, yes, mom can get down there and visit baby, but it does take a little bit of time for all of those pieces to come together. Further, if mom's having any complications and can't get down there quickly, that can sort of impede the process. Not to mention, not every baby who goes to the NICU is going to be able to jumpstart with breastfeeding right away. So some things to think about there. Sometimes supplementation is medically indicated. For example, say we're day 7, we're not seeing the stools that we want to see, we're still over 10% weight loss. We have some indications that maybe mom doesn't have enough supply or baby's not latching effectively to remove the supply. Supplementation then can become medically indicated. And yes, while all these other feeding methods are absolutely useful, again, paced bottle feeding is one of those methods that can certainly protect breastfeeding and get baby the volume that they need. It's also really important to acknowledge that some families decide that partner and other family member involvement is a must for the feeding baby and maybe for the mother's recovery or something like that. And if the family puts a strong emphasis on partner or other family member involvement, then bottle feeding is a very common practice for those other people in the family, and it's good for them to understand how to do paced bottle feeding. It's also important to have occasional flexibility. So while I don't recommend getting out of sync with babies' feeds, especially in the early days, it's completely fine if one night you need to sleep 4 or 5 hours because you didn't sleep before you went into labor, then you had 3 days of labor, then you went through a delivery, then you didn't sleep in the hospital, and now you're home and you feel like you haven't slept in years. You need one night of a good, robust chunk of sleep. That flexibility of, okay, we're going to give baby a bottle when he wakes up in the night, or dad's going to give a bottle, or grandma's going to give a bottle, or something like that, offers you occasional flexibility. Occasional being the operative word there, because if you do get into a routine where you're routinely not waking up for longer stretches of time, your milk supply will suffer just because you're not removing it, and that feedback inhibitor loop will kick in. Other examples, mom and dad want to go on a date. Crazy idea, but important, especially as you're adjusting to new parent life. It's good to check in with your partner and having that flexibility of being able to step away for even an hour or two. Knowing that your care provider can give baby a bottle in a format that is going to protect breastfeeding is very reassuring for the parent and good for baby. So it's important that we remember, a lot of times we talk about, bottles are bad. We don't want baby to take a bottle because of that potential that they'll develop the flow preference. Bottles are not necessarily the problem. How we use them really makes a difference. So, very long story short, bottles are not the enemy. Using them in a paced, baby-led way means they can support, not sabotage, breastfeeding. Paced bottle feeding helps your baby stay in control, prevents overfeeding, and protects your breastfeeding relationship. If bottles are a part of your plan, whether for a day, a season, or the long term, using this method makes all the difference. Share this episode with anyone who will ever give your baby a bottle so they know how to help protect the feeding journey you're working so hard for. Remember, you can always watch and listen to the weekly show wherever you get your podcasts. We drop a new episode every Monday, and detailed show notes can be found at themilkproduction.com. If you're looking for quick hits or smaller bites of info, we post clips on Facebook, Instagram, and YouTube, all at The Milk Production. Thanks for joining.
The Milk Production.